Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Now, we as a society are on a constant quest for perfection. We want prettier faces, better looking bodies, and of course, shinier and wider smiles. A lot of people opt to do what has been dubbed as the Hollywood smile, in which patients would go to their dentist and come out with a fresh set of teeth and of course, a brighter smile. But what is this procedure? Is it for everyone? And how much time and effort does it take? We sat down with dentist Mohamed Al-Aradi, who talked about this new and popular technique.
Basically, we call it, in our dental term, we call it veneers, which is a thin layer that we cement or put on the anterior teeth where your smile line is. So we're talking about a normal patient, good oral hygiene, and a perfect occlusion that when he bites with no complication and medically fit. That's the indication of the veneers. Vice versa, the contraindication of the veneers, it's the opposite side. A patient with a bad oral hygiene, a patient with a severe malocclusion, a processed patient, where those patients where they bite on their teeth too much. So that kind of patient, you kind of risk it when you do a veneer for them. So everybody is asking about extreme whites, natural look. They want it white and I want natural look. When you're thinking to visit a dentist for a veneer, the first step is just like you visit your dentist, sit with your dentist, have some kind of picture. That's the patient, what all the patients usually do. They have a picture, just like we want to have our teeth tooth exact the same, or for example, anyone. And it's just like, oh, okay, we can do that. Okay. The other thing, they don't know they might turn out wrong because it will turn out wrong because this is not how we're supposed to be. This is not how their facial figure, their face figure, their lip line, their nose line, jaw line, all these kind of things affects the veneer. Veneer, it's a simple process, but at the end of the day, it's a really hard job for the dental technician and for us also to design. So that's why when they created something called digital smile design, which is that the first step, photography. We have to take a photography, like we take professional photographs for the oral cavity, and then we have some program called Digital Smile Design, where we put the pictures in a program where they can have this all the tooth-like sets and how it will look like in the future. The other step, we have to take an impression. It's just like a negative of the patient teeth tooth. We have to make an impression and then we send it to the lab. Once we send it to the lab sends us something called a mock-up. It's just like you put a temporary inside a patient's mouth and let them go home and let them face the society about how they look like. The last step, when the patient confirms that he likes his new smile and everything, we have to start the preparation and all the things. One important thing that the patient should know and have to know, it's a must, that we have 3 types or 4 types of veneer preparation. We have non-prep veneer, where basically do not touch the tooth structure, we just cement after all the procedure that we discussed before. The other thing that we need to prepare a little bit from the tooth, just like remove a small layer from the teeth to get more retention. The last thing, which is I really don't recommend, is just like have this full coverage veneer, like extended veneer, which is similar to a crown. And in that case, the patient will be having he will lose a lot of tooth structure. At the same time, he will develop some kind of sensitivity, even if it's cement sweat. That's from a small personal experience. That's what patient will get, like sensitivity. Usually a veneer patient have to visit as any normal patients, but first time when the patient cement, or when we cement a veneer for a patient, at least 1 month follow-up, and then a 3-month follow-up, and then 6-month follow-up. Well, the thing that everybody have to know about is just like the oral hygiene have to increase, or we have to increase, the patient have to increase his oral hygiene up to the max with any artificial thing inside the oral cavity. Veneer, you should treat the veneer as your natural teeth, your own. So if you treat them as something different, you will definitely lose them. But they do stay white if the patient take a good care of them. They are not getting stained as a natural normal tooth because the layer of the porcelain and the Emax is so smooth, so the stains cannot adhere to the surface. And that's why all the veneer patients, they don't have too much stains on the buccal area, which is on this area, but they usually have stains in interdental area. It's just like in between the teeth. Well, if you're gonna do veneer, you should know what you want. I mean, they should know what they want. If they have a normal occlusion, natural teeth looking, aligned, they should start with the minimal stuffs. Like they should start with the bleaching. If they did not like the bleaching, then they should shift for the veneers. But veneer is not the only answer for a cosmetic point of view. We can start bleaching, we can start increasing the oral hygiene. If he have any bad habit, he should stop it. Smoking, coffee, all these habits should be stopped.
You're watching Healthy Minutes with Dr. Mo.